All right. All right. Welcome everyone to this the Sowing Seeds being a minority man in medicine panel. Um, Still waiting on a couple more people to come in, but we do have some wonderful guests here. So um, I think what we can do is just start off. If we want to just introduce ourselves. Um, I guess yeah. Let the panelists introduce themselves. Yeah. Sorry about that. Yeah.
Fair.
We can let the panelists introduce themselves.
No
So
problem. You
we can
want first,
start with
Mark?
yeah. Yeah. You guys can decide.
Um, sure. Yeah. Hey, everyone. Mark Hempley. I'm a second year psychiatry resident at Beth Israel Deaconess Medical Center up in Boston. I'm from New York City originally. Um, yeah, I'm just excited to be here.
Dope. My name is Lavanani. I'm an emergency medicine physician down here in the Nashville area. I practice specifically in Springfield, Tennessee. It's like 35 minutes from Nashville. Up there, I'm the medical director. I'm excited to be here. You know, whether we start without the two panelists or not, I know them personally, so hopefully they do show up and don't make me look bad. But uh, either way, I'm sure we'll have a great panel and really have a good time.
Mhm. Yeah, absolutely. Yeah, so I mean, you kind of talked about it, Dr. Anand, and you said like, excited to be here. So I guess if I guess another I guess somewhat introductory theme, I guess if we want to talk about, what not necessarily what here is in terms of the panel, but like how you got to each of where you guys are at. If you guys feel comfortable kind of just sharing, however much you guys are willing to share just about your path to medicine and then your path to, emergency medicine, psychiatry, or to whatever extent you guys feel comfortable sharing, just so we can, just better fully understand you.
All right.
Yeah.
I made you go first last time, so I'll go first this time. Um, for me, the last name may not be a dead giveaway, but my middle name is Chukwuemeka, so I'm actually Nigerian by background. And my mother constantly said growing up, you're gonna be a doctor, you're gonna be a doctor. She was a nurse, and as a lot of Nigerians, first generation Nigerians joke, you can either be a doctor, lawyer, or engineer. So I felt like I kept saying I was gonna be a doctor for a long time, and was just like, okay, when I get to college, I'll make up something else. And I kind of found the more you said it growing up, the more you got like pats on your heads and thumbs ups and kudos. So I was like, all right, maybe it'll be a pretty good job. And then I got to undergrad and I was like, oh, okay, I think I can do this. And I went to my first SNMA AMEC and I was like, okay, I can definitely do this. So that's what solidified and kind of helped me know that I can make it all the way to become a physician. As far as emergency medicine, I thought it was like one of the only types of doctors there were, right? So when I was growing up on TV, there was ER, and that was like the hottest show. So I thought every doctor kind of like just worked in a building, and then when you got sick, you went to go see the doctor. And I knew I had a primary and stuff like that, but I never like really thought I had to do more than that. So it was either primary or emergency medicine. So I signed on for emergency medicine. I wanted to be the jack of all trades and master of none. And I love about that about my lifestyle. And that's how I chose emergency medicine. And I went to Howard to do it, hence the polo. Homecoming just passed, so I had to rep something.
Oh man, that's so dope. Um, I think my story is a little different. I majored in theater in undergrad, and I was a performing artist and actor in New York City for a number of years. And I traveled the world as an actor. I went to London. I studied for a little bit in Russia. I think my cat's about to join us. Hello. Here we go. She wanted to join the live. And when I returned from traveling, I was actually a high school teacher for a little bit as well, a high school science teacher at a performing arts high school. And I think sort of those two experiences, the one as an actor, we really study character and we study like the psychological backgrounds of characters. And as a teacher, it's really important to sort of create these safe learning spaces for students. I taught at a majority minority school in Harlem. It's really important to like take care of them and really there's no learning that's going to take place unless you take care of all these other sort of social factors that are going on in their lives. And I think those two experiences really led me to psychiatry, even before applying to med school. And that's how I ended up going to med school eventually, and just choosing psychiatry.
Yeah, sorry. Yeah, so thank you for joining us, Dr. Bradley. I think that was like the first question, I guess one and a half. But if you'd like, if you just want to just introduce yourself, and then the subsequent question was just kind of just how you got here, right? Just a little bit about who you are and how you ended up in medicine and or critical care anesthesia to whatever extent you feel comfortable sharing.
Yeah. How much time do we have? No, I'm just kidding. Stephen Bradley. I'm an anesthesiologist and critical care physician. I went to the Howard University College of Medicine. Dr. Anani was one of my senior classmates, so we go way back. I was one of those kids that was not exposed to medicine at all growing up. My parents came from poverty, government housing, worked their way through college. It was their goal for their kids to have what they didn't have. So, they came to music lessons and sports and just like having a normal quote unquote life. I was initially going to study music in school, and then I was exposed to medicine through kind of a weird route where I was actually working construction during summer to pay for college. I was working at Shands Hospital doing high voltage electrical work in their basement. Weird exposure, but I saw the doctors and nurses. Basically, I saw people in scrubs looking back. I don't know what they actually did. They were probably like administrators or something. But that's what sparked that first interest. I didn't know if I was smart enough to become a physician, to be honest. So I'm a guy that always has a plan A and plan B. My plan B was physical therapy school. That's what I changed my major to. But I also took all the prereqs for medical school in case things worked out. Good Lord looks out for babes and fools. Stuff continued to work out. Went to grad school, went to Howard, and through exposure on my surgical rotation there in the ICU, that's what created my passion for critical care medicine. And I learned that you can get there through anesthesia as well as internal medicine or surgery. And that's kind of what set me out on this path.
Or emergency medicine.
Awesome. Yeah, so I guess we can just kind of get into just a few of the questions here that we had, and then I think probably later we'll open the floor to some questions. I think people had submitted their own and everything like that, and I think sometimes people will add them in the comments and stuff like that. So, but if at any point if there is something that you have a lot of flexibility. If you do want to take the conversation somewhere else or anything like that, you're more than welcome to. But if not, then we can just jump in, I guess, to just one of the first questions in just terms of just being a minority male and specifically just a Black male. I guess what if any kind of unique challenges you think that you face in medicine, right? Or just even like we were talking about just your guys' path to medicine, right? As you guys are a lot wiser now and able to just reflect on your path and kind of look back on your younger selves. Have there been some unique challenges that you think that that you faced that it would kind of just benefit others just to be aware of?
I think one of the challenges I personally felt like I faced as a Black male, specifically going to emergency medicine, especially the first son. Hopefully this is not going to be too deep, but like the immediate need as a male to be a provider, the path through medicine is not quick. The end game, you'll be able to provide for about 3-4 people at one time if you want to. But the path to get there is a little long, a little arduous, and you're going to need a whole lot of support. So you're going to have to take that kind of like, I feel specifically as Black male, we're supposed to be like the machoist of the macho, right? Like we're a threat just walking in the room half the time, that you're going to have to really take a step back and be vulnerable, for lack of better words. You're going to need money. You're going to need assistance. You're going to be like, hey, I actually need to be on your couch for a while. No, I can't pay rent this month, or yes, we are going to the Cheesecake Factory for our date because that's all I can afford and do right now. And so those are some of the things you're going to have to do as you go through your journey as a male in medicine. For me, that's what I personally think.
Yeah, I think to add to that, when I think of being a black male in medicine, um, right now we're the exception rather than the rule, and I think that it's it's sort of an interesting perspective to navigate. I went to a predominantly white institution for undergrad and for med school, so definitely sort of lack of mentorship. Just sort of not seeing very many people who look like me in medical school is its own kind of challenge as well. And I think it creates this sense that you have to do well or better. And I think it's taken a long time for me to accept that, sometimes, some days, you have to be comfortable with just doing enough to make sure that you can get to the next day.
I just want to first point out that Cheesecake Factory was on the list of places to not take your date now in 2023. The biggest thing that I exposed to, like Dr. Hemley mentioned, your pathway, whether you came through all HBCUs or PWIs, you have different experiences. And for me, one of the things that I learned quickly was how racism presents. It's rare that
Mm.
somebody in your profession is going to call you outside your name, at least to your face. Sure, you're going to have the encounters with your random patients. You're going to be having a great day. And then some old person is going to say something crazy or call you colored. And it's going to kind of hit you across the face and just kind of maybe ruin your day for a couple minutes or longer. And you got to learn how to deal with that. That's what we read about. That's what we hear about. But the other type of racism where it's behind closed doors and it looks like you getting a pass instead of an honors because it's a subjective scoring system in surgery, or you being the angry black man because you advocated for yourself, or an incredibly frustrating situation occurred and you were appropriately annoyed and a little wrinkle in your eyebrow just set everybody off and now they're all scared of you. And it's that like unspoken behind closed doors racism that you should probably pick up on pretty early. Having mentors can help you identify that, because the question that always comes up, is it because I did something wrong clinically, or there's an educational gap, or is it because I'm black? And being able to figure out which of those is going on can be key to your success. It's documented that we are dismissed from residency programs at a higher rate than our counterparts, even though we make up the vast minority. And for them to dismiss us, there is a pathway in place because we do have rights. There's, we're covered under working laws. There's a pathway that a lot of institutions can follow. So being kind of hip to the game, emotional intelligence, finding mentors to bounce ideas off of and say, hey, does this sound right to you, can help you succeed.
Absolutely. Yeah. And that's great advice. And you kind of when you were touching on like either thinly veiled racism or just the different, I guess, manifestations, that actually we had a very somewhat similar question, just I think a little more nuanced, but like talking about like microaggressions, but just going off of what you were talking about, right? Just the different manifestations of racism or discrimination, or just the different ways that that as a black male you can, I guess, find adversity in these spaces. What, I guess, what advice do you have on like how to effectively navigate this and yeah, just effectively navigating this, like I said, in all aspects of medicine, right? So whether it is med school, residency, right, or even like in the workforce, or amongst patients, it's just in all aspects of medicine.
You want to start off, Stephen Bradley, since you brought it up?
Sure, I'll start it off. For me, this is such a typical question because everybody's different. There's some people I admire and they are not going to stand for anything and they're going to just tell you how it is and give it right back to you. Me personally, I have locks right now. I didn't have locks when I was applying to medical school. I didn't have locks when I was applying to residency. For me, um, I was more concerned about getting in the door. And then I was like, I can change things from the inside. And that's how I went about it. The first year, 2 years in residency, I was trying to be a competent anesthesia resident, prove myself so everybody knew that I worked hard and that I'm generally unproblematic. So then the last 2 years, when something sideways was going on, I had that leverage to just pop off and be like, "Oh, hey, that's." I remember on rounds one day, like somebody said something crazy, and I was like, "Oh, that's racist," and like it was like 12 people in Mickey rounds, and they just like pause, and then they rephrase what they said, and like we kept going. But for me, it was I went about kind of building that social capital or that credibility so you could not accuse me he's just playing the race card. He's like, no, Bradley is a solid dude. If he says something, there's a problem. So that's how I went about it.
I definitely think two things to do. Just to highlight what Dr. Bradley said, I too am pro, as I like to coin it, assimilation for domination. I know some people hate that, but it's just like it's easier to get in the door and then change it from the inside than to come in and try to kick down the door and change everything else. It's not impossible to do it that way, and some see it as overly aggravating. And I've heard one person call it demeaning before, but to me, it's just the easier, safer route. But the other route that everyone should know, no matter what, is it's easy to have your rights violated when you don't know your rights, right? So you don't know the pathway. If you don't know, oh, I'm supposed to get 2 strikes. If you don't know, oh, I was supposed to get probation before I got that email to go out. If you don't know those things, then it's easy kind of just to get swept up. And what happens that I find a lot is students oftentimes, once they get in trouble, will then start reading through the brochure or the packet that they got from the program to figure out the process, but you're already 2 steps behind it, to me, at that point. So it's really important to know your rights ahead of time. And again, I'm pro assimilation for domination.
Yeah, I think to add to that perspective, I really think a lot about allyship, and the importance of being an ally to other minoritized and marginalized communities sort of in residency, but also holding them accountable to be an ally for myself as well. So I think it's really just sort of building this community of allies among minoritized communities has also been helpful as well.
Absolutely, absolutely. Thank you so much. Yeah, so we have a new guest to the stage. If you would like just to briefly introduce yourself, who you are, where you're at, and just so we know a little bit more about you.
Sure, absolutely. Good evening, everybody. Apologize for my tardiness. I was not dealing with a STEMI, actually. As Dr. Anani had suggested, I was actually getting back from a little quick city tour, basically. I'm in Atlanta right now for an interview, but it's besides the point. My name is Marius Jacora, senior cardiology fellow at University of Pennsylvania, by way of Duke University for internal medicine and Howard University College of Medicine for medical school. And I am currently interviewing all across the East Coast for a non-invasive general cardiologist job with a specialization in sports and exercise cardiology. So I'm happy to be here to talk and represent for the Black men in medicine.
Yeah, great. Thank you. Yeah, so we were just, one of the previous questions was just touching on just some barriers or adversities or unique challenges that maybe you feel you face just as a Black man in medicine, whether that was in your path at any point in your path to medicine, or that in medical school, or then now just being or even like now like interviewing and just everything about your path. So if there was something that you wanted to share, then we'd love to hear it. If not, then we do have some more questions.
Yeah, absolutely. Happy to share. And again, I don't know what's been said already. I just got on, but if there's anything I'm saying that's now going to be repeated by me, you understand it's a consistent theme. So there's no script here. I have no idea what these guys said, but it goes without saying, being a Black male in this field, that's predominantly really white male, um, there's oftentimes this concept of the Black tax you may have heard about. We carry this weight where we represent basically every Black male that comes after us, and we feel like we're under this microscope. And sometimes it's really just a psychological thing, and it's not real, but sometimes it is real. It's legitimate, where we basically set the standard for what the perception is of Black men in medicine and their potential to be clinically excellent and competent physicians. So it's a little bit more pressure than some of our white colleagues or really any other counterparts have to deal with. Oftentimes, me personally, I'll tell a story. When I was at Duke, after my first year, there was 3 Black men in my class. And you live within your own silo. Sometimes you don't know what other feedback your other colleagues are getting or whatnot after they go through rotations. But I felt like I wasn't up to par to a point, and I was struggling. But the next year, the next class, there were no Black men they took in, and I thought it was because of me. Now, I actually ended up voicing that to my program director and GME during this open forum type of talk, just sharing it. And they, thought it was very silly, and they assured me that that wasn't the case, and they ranked people in the match. But just the idea that you feel like you and your performance and the way you go about your day to day could impact all those coming after you. It's a heavy weight, heavy burden to carry. And I felt it even in fellowship, in cardiology. So it's something that again, it's some of it may be just psychological and not real, but I think there is some weight to that kind of changes how you navigate your steps.
Absolutely, absolutely. Thank you so much. I know, like a follow-up question that was to that is just like, um, how can one, I guess, advocate for themselves in those situations, right? Or what strategies do you have to kind of, yeah, I guess, advocate for yourself in situations like that?
Asking me or
Yeah,
generally?
sorry. Yeah, it was a follow-up to your comment because that was the rest of the panelists had already answered that. Sorry about that. Yes.
Got it. I think it's really just talking to somebody, finding somebody who's a
Mhm.
point person who you trust. And when I say somebody, I mean somebody that's in a position to do something about it if it's legitimate. You have your coworkers and your colleagues. You may have a couple people you trust and you feel like you can vent to, but you need to find somebody who's in a position. And medicine is a very hierarchical field. I hate to say above you, but somebody who's like in leadership, or you're attending, or a mentor that you can talk to candidly and tell them what you're going through, what you're experiencing, and then they can oftentimes kind of advise you on steps to take. And really, if it is legitimate, they can advise you on steps to take for action against whatever's happening, or they can really talk you out of it and help you realize that it's not reality. I think,
Mhm.
oftentimes we go to people that look like us, that may have similar backgrounds as our go-to people who we trust the most. I know in my program we had assigned coaches, but my assigned coach, I mean, it was a Caucasian woman, and I really don't have to say much after that. There's not much we can relate on in terms of what I'm experiencing currently or at that time in the position I was in, and her experience in residency. She probably couldn't relate. So I think sometimes you have to take the extra step and go out and find your own trusted individual to talk to.
Yeah, that's a great point. I guess so. Like another, um, I guess, question, kind of building off of that is, have you guys been able to, like I said, just in maybe where you're at now, or in previous steps in your careers, like, to what extent have you guys been able to, I guess, foster a sense of community amongst, if at all, right, amongst just either Black men at your school or neighboring schools, right, and for those of you that have, right, I guess what kind of what kind of benefits did that how beneficial was that for you? And, what kind of utility did that serve for you? Just like in your, any sort of growth, right? Personal, professional, emotional, spiritual, anything like that.
So I found, as I said earlier, I'm currently the medical director at my site, and it was just me, but I was able to hire two new African American males. So it's been pretty dope. They started in August. It's been great getting to know them. It's like, once you get to this stage of your life, especially like when you have a wife and children like myself, you're pretty siloed. Like at home, you already have like your church family, you have your real family. But what I found having like coworkers who look like me, relate to me, that even at 5-10 minutes or 30 minutes, depending on how much overlap there is, because it is emergency medicine, that I have with my colleagues, it's a new breath of fresh air. Like case in point, it's going to sound ridiculous, but when I come in and do sign up my other colleagues, it's like, oh great, there's this many patients, maybe did you see that game yesterday, or how's the weather? But now I get to come in and be like, yo, did you see what happened in Alabama with the riverboat? And have like a 30-minute conversation about that. Like I couldn't do that beforehand. And that makes my day happier. It makes me happier going to work, makes me happier getting sign out. And it makes me feel more me in that place. And so, yeah, really, we had like a 20-minute conversation after that because it was great. But that's something I would not have been able to do before they got there. So that's one of the benefits of having brothers in the space, I can say.
Sorry.
Yeah. So plug for University of Chicago. It's where I did my training. And through the internal medicine department, they said, hey, we need more diversity. We need more Black people to come here. They secured funding from their department to build the House Staff Diversity Committee. This is circa 2014, 2015. And so that provided funding for us to have different events. There was times I had 40 to 45 Black or underrepresented minority residents from multiple specialties at my house. Like I had money, I cooked a pot of Thai curry, and they brought dessert, and we just had a good time. And we did that, a couple times a year. And then, COVID set that back a little bit, but it's still going. So demanding from your organization to kind of help fund and support these networks is huge. To what Dr. Anani said, it kind of changes because at your day job, you'll find, you're not spending as much time at work. So I was in the Navy at my current institution, there's only a handful. Like it just got like more spread out the further I got out of training. And it's great to work with people that look like you. But those relationships change. I just started a new job. The anesthesia department was not very diverse. They'd hired one Black man a year before, or like he'd started right when I was interviewing last year. And he was invaluable in the hiring process, was giving me all the information I needed. I'm an anesthesiologist. Orthopedic surgeon strolled in during my interview. I'm like, oh, what are you doing here? And then I was like, why are you on my schedule? And then I saw him. I was like, oh, okay, I get it. But he didn't just show up. Like he was there for me when I was like, what's this contract? I had an issue with this. I called him up and he gave me advice. I ran into him today. He's just a wealth of information and knowledge to help me navigate that hiring process. It doesn't mean that every Black person you see needs to come work at your job, because maybe that's not the right spot for them to be at. Or maybe you don't like your job. So why would you bring somebody to a place that you don't want to be at? But being there to give that advice, or actually to be 10 toes down and support the people coming behind you is invaluable.
Yeah, and I think to add to that, I see for myself, even the challenges that sort of I go through, or like I went through to become a resident here up in Boston. My hope and sort of my goal is to make it easier for the next person coming through. And I feel like being involved in the recruitment process was something that was important to me. And it was really important to just show face, just be that person. In on the other side of the interview table now, interviewing folks for residency, I found that really, really enjoyable. And also, it's community is such an expansive word, even beyond residency. Like I have like a plug for Caribbean food. I have a plug for like Ethiopian food. I have an Ethiopian restaurant that's like 15 minutes walk from me. It's like it's really just going out outside the hospital walls. You can find community out there too, and it doesn't necessarily have to be within medicine.
Yeah, great. Those are all, yeah, that was a lot of wisdom. We really appreciate that. Just again, just transitioning from like, the community and kind of just I'm hearing all the benefits that it's kind of giving you guys. I guess another question is kind of expanding on that. I guess what role has like mentorship played in for each of you guys, whether that's receiving mentorship or well, I guess we if you can't answer both, we can do both. Just even receiving mentorship and or being a mentor. So what role has kind of like receiving mentorship? What role has that kind of played just in you guys' career? And yeah, so we can start with that.
I guess I'm actually going to give a plug for. I think it was an SNMA sort of mentorship for a residency application. I was
Mm.
paired with someone who was a practicing psychiatrist, and he walked me through the application process. And I think I feel very, very fortunate to have had this person. We had mock interviews. We had several feedback sessions for my personal statement. We had just sort of reworking my CV, just to hit the points that really mattered, that really mattered to the people who were in positions of power. So I definitely think that was an invaluable experience, and it's something that I definitely have paid forward. Anyone who's reached out to me for residency application advice, like I would respond immediately, and I try to answer as many questions as I could. Just because, I definitely feel like mentorship is great. It's also great to be as informed as possible before you're taking the next steps. So, finding people who are those plugs, who are those like well springs of information, are sort of useful to add to your network.
Someone in the comments, I guess, had put it's the SNMA Road to Residency program with T4D. I think that's what it was. Okay, yeah. So for all those listening, SNMA Road to Residency program with T4D. That's
Yeah,
what
yeah,
Dr. Hamlin was talking
absolutely.
about.
Yeah, I
Yeah.
think that's a tour for diversity or something. Yeah, yeah.
Yep. Mm-hmm.
Mhm.
So I will jump in because I'm already off mute. Yeah, I put that in the chat. T4D that is still going. All the videos are on this year. So good luck to everyone who was part of the program this year. I will tell anyone and everyone, my probably number one mentor in emergency medicine is Dr. Alden Landry up at Boston. He got me in here, no doubt. And one of the benefits of a mentor, I think everyone kind of knows this implicitly, but I'll just say it out loud, is not only someone who has your back 24/7, but someone who can say your name in rooms that you're not in already. So I was applying to emergency medicine. Look, I know we're probably down right now amongst current med students, but we were up back in 2012. All right. And applying was ridiculous. And I had failed step one, but he knew me as, national parliamentarian for SNMA, student council president for my school, and prior class president. He saw me for what I was. So he got me an away rotation at Harvard, right? He was able to write me a letter of recommendation. He was able to write me a SLOR, and he was able to do all these things and connect me with all these people. And most importantly, he was honest to me. He was like, "You're a great candidate." you're not coming to Harvard, but you're a great candidate. And he steered me to all the right places and talked to all the right people. I'm still here to this day because of him. And if I can emulate a fraction of what he's done for me, for other people, then I think I'd have done a good job in this world.
Yeah, I think it's goes without saying, kind of stuff I was touching on before, like, finding a mentor, it's really an invaluable, asset to your trajectory and your path, just because, the whole concept is really to make whatever you're going through, easier, and take out, potential for error that your mentor potentially had gone through themselves or they witnessed in others. They should be able to really help navigate your steps, to help make it, the easiest as possible. Not saying it's going to be an easy road no matter what. It's going to be, faced with trials and tribulations, but it shouldn't be to the degree in which it would have been, difficult without mentorship. And then me as an individual, I've received a lot of mentorship from people before me. I've been able to, be fortunate in the opportunity, through SNMA, through different organizations, and even just through personal connection, provide mentorship for others who are coming after me. Again, it's the same concept, just really helping people avoid mistakes or any kind of, difficulties that I may have had on the road. And sometimes, being a good mentor and also being a good mentee, it's a two-way street. You really have to, pour into it to really get out of it. Mentees sometimes expect certain mentors to really be the ones that are proactive and being the one taking the initiative to initiate and engage in conversation about life updates or whatnot. And on the flip side, some mentors feel like mentees are the ones who are supposed to be taking all of that initiative, but it really needs to be kind of give and take. And, the best mentee-mentor relationships are the ones who both pour into the relationship and really foster active engagement.
Yeah, that was actually going to be one of my kind of follow-up questions, is like, what advice do you have, just for some of our young brothers who might be seeking mentorship, right? Like, what is like a good piece of advice on being a good mentee, and kind of just how to best maintain and, give back to that mentor-mentee relationship. So if anyone else had, I guess, any additional input on that.
Yeah, I'll chime in because I'm not a good mentor or mentee. I just don't, I'm not good with longitudinal relationships aside from my wife. But what I see, the times that I've needed somebody to be there, I come with a discrete question. I was fortunate to have some people that are more involved with clinically, and I could come to them and say, "Hey, I'm looking at this, this, and this. Should I go for chief resident? Should I do an ethics fellowship? What do you think?" And then they're like, "Oh, hey, ethics fellowship, you can use that in your career further on." So that's how I have been able to use mentorship. On the other side, what I say for students that are seeking mentorship, and what Dr. Chikura just mentioned, like, you need to figure out what that relationship looks like. And for me, you got to ask me a direct question. I get people all the time. It's like, "Oh, why did you choose anesthesia?" It's like, I don't have 45 minutes to like go through. I'm going to say the same thing, 95% of the same thing that everybody says about going into anesthesia. But when you say, should I do an away rotation? Yes, no. I like, those are like actionable things that we could discuss. Number two is a time, because we get caught back and forth. "Oh yeah, I'm free next week. Hit me up. What time works for you?" "Well, I'm free in the morning. What time works for you?" And then nothing ever happens. Um, as students, you're busy. As residents, fellows, attendings, we're busy. There's tons of emails coming back and forth. So put a time in that email. Say, "Hey, does this time work for you?" Get it on each other's calendars, and then you'll actually be able to meet. And then you can ask, whatever question you have, because you got that person for a half hour. But those are the two things that I see mentor-mentee relationships failing. But that's how you can kind of tighten those relationships and have them be more beneficial.
Along those lines, again, if you're bold enough to hop in someone's DMs for like their number, you should be bold enough to ask a mentor for their email and to be a mentor, right? So step one is asking. You should not just assume Don't assume because someone has, a big IG page or a super cool podcast that they won't mentor you or ask you or answer your question. They might. So, just send them a message. That's number one. And then number two, it's follow-ups, right? You definitely want to, as a student or the mentee, it's always good to send updates, right? The mentor has kind of like been there, done that. And if there's like a longitudinal project y'all are working on, they'll reach back out to you. But I'm not going to reach out to you to ask you, how the rotation is going. If you have trouble, reach out. What a good mentor should be doing, though, is sending you like opportunities like, hey, there's this program coming up out here. Hey, there's this coming up. But just know, as much as you want from that mentor to say yes to answer all your questions, you need to say yes to your mentor to help them out as well. They may need you on that paper writing. They may need you to do some research for them. They may need you just to post something in a chat group that you have access to that they don't have access to. So two-way street, 100% of the time, you gotta be down to do it.
Yeah,
Yeah.
I would second. I would second. Oh, sorry to cut you off there. But I would definitely second clear expectations on mentee mentor relationship. I think every dyad like that is different based on sort of where you are in your journey and the different needs that you might have. To plug Dr. Landry, he actually is one of my mentors. Not in emergency medicine, but I'm connected with him more of like globally of like trying to figure out sort of Harvard as an institution. He's kind of reached out to me to be a mentor in that way. And that's like our relationship. That's like we've set that expectation early that like I'm interested in potentially staying on here as faculty. How in the world can I do that? So definitely clear expectations very early on helps to set the relationship, and also sort of also helps to set benchmarks and goals for both the mentor and the mentee in this relationship.
Yeah, absolutely, absolutely. Those are all the absolute things that we should be mindful of. If there were comments, if there were people that had questions, feel free to put them in the chat now. I mean, I have like one or two more questions, but I just want to preemptively just get that out there, so we can kind of ask those. But another question, I did have, that we did have, was, just so if there was I guess, one piece of advice that, if that you would probably, just give to some of our young brothers, probably just either in the pre-med stage or those of us that are in med school. If there was just one piece of advice that, so there's a contingency here. One piece of advice that, if our young brothers kind of internalized, and, if they followed through with that, if that's something that it really stuck with them, that, that they would be good, they'd be straight, so long as they kind of internalize this piece of advice. What would that be?
I can start. Lean in and enjoy the journey. It's easy to get fixated on the destination, which is matching into your dream specialty or matching at your dream program. And, life sometimes doesn't line up with what we think we need, depending on, if you're a person of faith or serendipity, whatever you believe in. The way you see your life going may not be the way your life is intended to go. But what you can do is lean into that journey and enjoy every moment of life. It sucks when you're studying for step one and you're waiting on interview requests. Like that, those are the valleys, but there's a lot of peaks in there. And to get you through those valleys, I'm somebody that also lives in the past. So at the end of my first semester of medical school, when I was thinking like, am I smart? Should I come back to school? Even I could look back and say, well, hey, you made it this far. Or when I'm in intern year and I'm dying and I'm like, well, you wanted this so bad a year ago. You were doing anything you could to match in a residency, and you're here now. So keep going. So that's the advice that I would give.
My advice is always corny and is always simple. you can do it, right? Like I have no clue why this job as a physician seems so astronomically or so unreachable for men of our background, right? Like Chris Holloman out there, he saw me and a bunch of others go through medical school. He knew we could do it. He didn't want to do it, but he knew we could do it. But we would talk to other people like around us in our circle, and they'd be like, "Oh, y'all in med school? Y'all want to be a doctor? Man, y'all crazy. That's undoable. All right, what do you want to do? Oh, man, I'm gonna be in the league. What? That's like 1% of 1% of people, and that is a acceptable dream. But physician is not doable. So I think the one thing I needed someone to tell me is where SNMA came in, to continue this journey, like Dr. Bradley said, to go through that MCAT, to go through all those, orgos, to go through all of those tests and classes, was to know that this was doable. This is not some astronomical goal that is unachievable by man. Like, it is very doable. You can do it. You just have to play the game and, reach the statistics to make it there.
I think it's hard to follow up those, but for me, it's often a saying I've heard multiple times over my career, and I'll definitely say it's true. Sometimes as a Black male, you have to grind, work, really push twice as hard to go half as far. Reason being, again, we're always under this microscope, and people really, again, imposter syndrome is real, right? Imposter syndrome is, a psychological thing where, oftentimes most people of color, specifically men of color, think that they don't belong in an environment. They may not be adequate. They may not be up to speed with their, colleagues in comparison. I think, oftentimes that is just not true. But to say that we're not being watched and, a little bit more under the more scrutiny to make sure we do belong, that may be true. And, you may oftentimes realize, your counterparts who are of the majority demographic, they have certain connections and certain, I don't want to say leg up, but they have a leg up in many scenarios where they're offered different opportunities, sometimes based off of mediocre presentation, mediocre work, where you may be the one who, is grinding and, staying late, doing work after hours, you name it, doing twice as much of the work at the input and getting the same output, if not less, based off of what's actually offered to you. So it's something oftentimes where it can be a little demoralizing to think like that. But if you come to terms with it being a possibility and very much so a reality in some cases, you will be able to, I guess, navigate a little bit more gracefully and understand and not take things so much to heart, where it's to the point where it's debilitating. Because sometimes when you feel like you have so much of an obstacle before you to attain something, you just kind of get in this state of paralysis and feel like you can't do it. I would just say, put your head down, grind, understand we all go through the same thing. Oftentimes we're under the same microscope. It's kind of that same black tax concept I was talking about earlier. Sometimes you got to carry it with pride. You got to know it's a thing, and it is what it is. And you're here to, show out for those coming after you and, get yours. Stay hungry and get yours.
I would say at every point of your journey, wherever you are, pre-med, med student, in the app cycle now, in residency, even as attendings. Hello, attendings. But I think at every stage you are perspective building. And it's something that I share sort of with my therapy patients a lot, that two things can be true. You can get the perspective of all of these folks, who are here with different walks of life, on their journey. You can hold those, and then you can also hold and acknowledge that your journey is your own. And I think those are two important things that I would offer to anyone to just sort of think about and internalize. That both what you are experiencing and sort of what we have all experienced are true and real experiences, and that they are both important in sort of your own identity formation.
Yeah, absolutely. Those were all wonderful pieces of advice. Yeah, absolutely. That was real wisdom. Um, so I guess, and we have I had like a few more, but I know just for time's sake, I guess we'll kind of end with like a more important one, I guess. Obviously, like this is just about being a minority male in medicine, being a black male. But I guess in just thinking about the parallels that many of our sisters probably or not even probably are absolutely experiencing in that aspect, right? And we talked about advocating and kind of just being able to navigate spaces and all the things that come with that. How what are ways that just that that us and a lot of young brothers in different stages of this journey, right, can kind of just be there for our sisters that are going through similar things, or like everything that we kind of talked about, just tonight, right? What are kind of the ways that we can, like I said, either advocating for them or just helping them navigate certain spaces, helping just foster communities and things like that. What have been ways that maybe you guys have done that, or that that some of our viewers, the young brothers watching should be mindful of, and just helping them along their journey as well.
I guess I'll say the quiet part loud and the loud part loud. So the quiet part loud is allyship first is always like the most helpful, right? You see someone call them out their name, correct them. You see multiple people think they're a nurse, correct them. Anything that you need, anything that you see them going through, like be there for them the same way you'd be there for a brother. Like that would be the easiest way, because y'all are both probably going through it at the same time. The loud part I will say out loud is there are more African American women in medicine than men, like by a lot. So they're going to be, it's going to be a 2-to-1 ratio. So I don't say that as some kind of like hunting game, like joke. I say that as like, if you are going to be there as an ally, make sure you be there as an ally, right? I don't want to assume that every black man in medicine thinks they're like the ish, and every woman they talk to they're supposed to get with. Like that's not true. So you can just be there as a friend, as a guide, and say, look, yo, we're in the trenches together. Forget gender at this point. We're gonna make it through together. And that can be just it. But I think you have to make them comfortable and understand that you are there as an ally and a friend, and not another number at that. And I think you can make it through together. You can also talk about Cheesecake Factory too. I mean, that's another thing if you want to go that route. Apparently you can ask them about their ideas and thoughts on that, for levity if you need to. It's always a good topic nowadays, it seems like.
Or how many oysters they eat at the oyster bar. Is that another one?
I could piggyback on what Dr. Nani said. And yeah, like having that supportive, collaborative environment, because even as a black male in medicine, I've witnessed, white female residents be disrespected even more. The patients will think I'm a doctor because I'm a male. When I was a resident, and then my woman attending physician had happened with a white female attending and a black female attending. They talked to me the whole time. So realize that this kind of discrimination doesn't come in just one size or flavor. And like Dr. Nani mentioned, like do your part to help correct these behaviors.
I was going to say the objective numbers actually touches to both Dr. Anani's point and Dr. Bradley's point. The objective numbers in the statistics would show that there's less Black males in medicine. But when you have the demographic of Black women in medicine, they may be perceived as the minority, really being like a double minority, because the majority, the picture of the, I guess, the ideal doctor in America's society is a white male. That's like what they think of when they see a doctor, a white old male at that. So when you see a young Black female, they meet the minority criteria across three different, buckets. So I feel like oftentimes young Black women are the ones who get discriminated against the most. I find them to be oftentimes in a position like Dr. Bradley's talking about, where, they're in the room and they could be the most senior in the room. They could be the attending, but the patient's never looking at them first for, authority in the room. They're looking to find, where can they find the first white person, beyond that, the first male, and beyond that, the oldest person in the room. And that could be the nurse, right? But they're thinking that's the doctor. So it's really like, it's all superficial. I think at the end of the day, again, to Dr. Anani's point, the allyship, you have to be able to support, Black women in their roles, and especially in medicine. I think that it goes without saying, if you witness anything that seems to be derogatory, discriminatory against them, in medicine, the best thing we can do is speak up and help to, empower them to, assert their role. The goal is not to be aggressors when we face conflict like that, but being assertive, there's nothing wrong with that, and saying exactly who's who in what scenario, and help people kind of normalize what their idea is of a physician.
Oh man, I love that. I was the first thing I thought of was like, oh man, the sisters I know are really strong. So it's I thought of it from the perspective of, if to kind of link what everyone else has said, like if that is the case, that this perception of this triple minority, just sort of minoritized, marginalized view of Black women in the medical space, if that does exist, and if as Black males we do have an opportunity to have some privilege, some say, we do end up in positions of leadership. It's really just about allyship. To me, it just seems like you just get them to the table. You make sure that they're also at the table, and then have them speak for themselves. I think that's like one of, if not the most important way that we can show that we're allies, and sort of using that privilege that we do have as being male. We check one of that criteria, of the patient's perspective of what a doctor is.
Yeah, absolutely. I know it's almost 9 o'clock, but I know Dr. Anani wanted, a final comment. I know if you wanted to bring something up.
Yeah, your question made me think of something. I sit on a lot of panels in the background, and I host a lot of these. And one thing that I found ironic, or I finally noticed in a panel like this, if this were a panel of all female physicians, or women physicians, I feel like probably 45 minutes ago, someone would have asked the question about family planning. But it's a panel of all men, and we usually don't get asked that question. And I just want to throw out there to all the brothers watching, you do have a say in that as well. So, I mean, obviously we don't have time now, but you should start deciding, at what age do you want kids? What age do you want to get married? How do you want to get married? Do you want a house with 2-car garage, 3-car garage? Because I do feel like the ladies have that all on lock by like the end of step 1 studying. But we don't think about that until we're about to graduate residency, and there's a disconnect there. So I want to throw it out, since you brought up the ladies. Just throw it out there.
Absolutely, yeah. That's a great point. That's absolutely a great point. So, like I said, it's 9 o'clock now. We got our final comments in. So yeah, just really appreciate you guys coming out and speaking with us, and sharing a lot of that wisdom. Really invaluable. I don't know where else we would have gotten that. So Yeah, thank you so much. And you guys have a great night. And I'll reach out to you, Dr. Bradley, on Instagram. No, I'm just kidding. I'll email you.
Shoot that shot.
All right. All right. You guys have a wonderful night. Rest of your night. Okay.
Hey,
You too.
thanks for having me.
All right.
All right.
Thank you. Thanks again.